my name's Gilly Bond and I'm a pelvic health physio, and today I'd like to talk to you about relaxing your pelvic floor. So that's something that I ask a lot of my patients to do. If you've got any pelvic pain, if anything's hurting inside, especially when you need the toilet, if you have any intimacy with your other partner, things like that, then having a relaxation of your pelvic floor is really important. And some of you may have come to this video because I've told you to from clinic, so I want you to really listen carefully and have a go at relaxing your pelvic floor. The first thing to do is to think about where that pelvic floor is and what it is. And if you don't really know about the pelvic floor, and you don't really know about its anatomy, go and have a look at my anatomy of the pelvic floor video. It tells you all about it and how to activate it. But for the purposes of today, we're going to think about pulling in that back passage, because we know that activates pretty much quite a lot of the pelvic floor, if not all of it. So sit down comfortably. Just take a nice bit of a relax. Make sure that you're back into the chair as comfortably as you can be. Think about relaxing your tummy muscle, relaxing your legs, relaxing your bottom muscles, and just sitting nice and quietly. From there, pull in your back passage as if to stop from breaking wind and pulling it up and forwards towards your pubic bone. Okay, imagining it going in that diagonal position, that diagonal line up and forwards. Having done that a little bit, not too hard, just let it drop all the way down. I want you to keep thinking about that feeling of it releasing all the way down. And again, you're going to pull in that back passage, up and forwards towards your pubic bone, and then relax it all the way down. Thinking about releasing those fibres, about the space between your two sitting bones, relaxing all the way down. Okay, we're going to add some breath to that now. And again, if you've not watched the video about deep breathing or how to do a good diaphragmatic breath, then have a look at that over on one of my other videos. I'll put a link here later. So what you're going to think about is having that lovely soft belly, soft bottom, and as you breathe in, your tummy raises up and forwards. So we have a deep breath in and breathe out, and just ignore that telephone, and deep breath in and breathe out. Soft belly. Try that a few more times. Deep breath in and breathe out. Good. Now, using that breath, we're going to release the pelvic floor. So again, this time, as you breathe in, you should feel the pelvic floor relax downwards. So as you breathe out, pull in that pelvic floor a little bit, and then breathe in and feel it dropping all the way down. If you can't quite feel it where you're sitting, try just leaning a little bit further forwards, but making sure that you're upright so that we're not slouching into that position, but being a bit more upright. In this position, there is a sweet spot where things are absolutely lined next to each other, and that as the diaphragm descends, so does the pelvic floor, like a piston. And if we're not perfectly aligned, and one's like this, and a pelvic floor's here, then you might not feel it so well. So just lean forward and take that lovely deep breath. Good. And as you soften your tummy and breathe in, you should feel a little bit of pressure down below between your legs. And that's a cue for you to relax that pelvic floor. So pulling in your back passage, and now breathe in and relax it all the way down. Good. And again, trying to pulling in that back passage, and as you breathe in, relax it all the way down. Something to practice. You can practice it separately or you can practice it together, but either which way, the more time that you spend trying to relax that pelvic floor down and release it can really help with your pelvic pain, especially if you're having treatment at the same time. If you're not, you can still have a go, but if you're having any manual treatment where we're trying to release and relax that pelvic floor, that's great. It'll get you nice and relaxed, but then what happens when you go home? You need to keep practicing that so that that tension doesn't build. Okay, so hopefully this works for you and you're feeling a bit more comfortable, a bit more relaxed down below, a bit more relaxed in your tummy and your pelvic region now. But carry on practicing. And if you've got anything to talk to me about, if you want to comment on anything or ask me a question, find me at Gilly_Bond on Twitter or on Facebook, and I'd love to hear from you. So all the best practicing.